Well, welcome to part 7, and we're going to talk about some preventative measures. Immunity. Immunity is important for us because it is a defense that we have that can prevent us from catching a disease or becoming infected with a pathogen before we do anything, before even coming in contact with it. So let's make sure that we have been immunized or vaccinated and make sure they're up to date. And our immunity, that's where it comes from mainly, is from your immunizations that you've had or from vaccines that you've had. Or you can get it from where you've had a past illness. Like, for instance, like chicken pox. If you've had chicken pox, you will have a bit of immunity to it. Sometimes the immunity is only partial. Sometimes you can have an immunity for a period of time and then that immunity goes away. That's why, like with our hepatitis B shots, we have to have a titer done every so often, and then that's why we also have to have boosters. So as a human, we can't form immunity to some diseases. Some diseases, there's no matter what we do, we're going to catch it. One, there's not a vaccine or anything for the common cold, and it seems like every year millions of people contract the common cold. So, and sometimes what's funny about just being human, I guess, or being people, is that sometimes a germ or pathogen may give one person some violent side effects or symptoms that's very painful or very uncomfortable, whereas in some others it's not so bad. So one thing to do for you to do to help prevent infection is to make sure you maintain a healthy lifestyle. Make sure you eat a good meal, that you have a good diet, that you get exercise, that you do things to reduce stress, because stress can reduce your immunity. Make sure you take in you're getting all the vitamins, minerals that you need every day as according to your physician. Make sure you receive your vaccinations and your boosters. Get a tuberculosis skin test every year, and if it's positive, make sure you follow up with your physician and take care of that. And always follow standard precautions, and like I said earlier, at minimum, you're going to always wear gloves on every patient contact, because we don't know which patients have communicable diseases. You cannot guess at them by their appearance or by their social economic status or whatnot. So if you're exposed to a patient's blood or body fluids, what you want to do is turn patient care over to another EMS provider if possible, or as soon as possible. When safe to do so, clean the exposed area. You can do this with soap and water or some type of cleaning agent, alcohol swabs. You want to get the pathogen off of you is what you want to do. If it's in your eyes, rinse your eyes if necessary. Like if you're on the truck and you're in the ambulance, you've got an IV bag. You can use normal saline if needed. And activate your department's infection control plan as soon as possible. The earlier the better. And get involved. Go to your infection control nurse or whoever that your department has set up. Some departments are in with hospitals and they have an extensive infection control plan, and some are with private physicians. But either way, they will be on top of and know what best therapies to give to you to help prevent things. There are some modalities. Even if you are exposed to someone who has HIV, there are some medications out there that can reduce the chances of you actually contracting the disease. So make sure you follow up and you let people know that you have been exposed so that you can get the proper treatment as early as possible. So that wraps up this small section. I hope these small sections are going okay for you. I would like to, and as part of an assignment, to check and see if you are listening well, I want you to give me some feedback on it. I know that this stuff is dry. It's not exciting stuff right now, but give me some feedback. Do you like the longer lectures, because I can go up to 15 minutes, or are the shorter ones better and easier for you to deal with? All right, well, you can shoot me an email. You can do it through the course room, or you can do it to my personal email, whichever one's best. And this should be an easy A for you. So, thank you.